Around about 2 years ago now, we got going with setting it up, and for the last 18 months or so I've been seeing patients virtually. Heather Kadri has been seeing the patients, and then we've been looking at the records, working out how to treat them, and then she's been putting the orthodontic appliances on and undertaking the treatment. And now we're in the state where I, for the first time, to actually review those patients, and we're also looking at the ones for the next year or so together, coming up with treatment plans. It's the first time that I'm aware that orthodontics has been done that way. So it's been quite interesting and exciting for me as well. And initially I had no idea whether it would work. It's obviously quite unusual to treatment plan cases without meeting the people, but it's actually been really, really good. I found using the remote records really easy actually, and it's been really good. And when I've been seeing the actual patients this week, it's very much accorded with what I expected to see. I think it's a model that in time will expand to other settings like the Falklands, where you might have a general dental service but you don't have a specialist orthodontic service. And certainly from Heather's point of view and mine, we see that as been a model that you could export elsewhere. And of course it's exciting being involved in something that's the start of things. There are three aspects to the future development. The first is, when we first started, we had to start with the most urgent year groups, which translates to those that are furthest up the school because they've got the least time to complete treatment. So one development of the service is we're now able to extend it down to the earlier year groups. The second is we're able to expand the type of braces we can use. So all the cases we've treated so far have been with fixed braces, which is the conventional train track style brace. We're now adding in some braces that modify growth. So if someone, for example, has got a lower jaw that's further back than we want it to be, if you can treat the patient when they're growing, you can actually use an appliance that helps to grow the jaw forward. So for example, we're now able to start bringing those into the service. Thirdly, we're also in communication with the oral surgeon who comes twice a year, and we're now going to be able to treat some cases. For example, if a tooth's gone offline and is buried in the jawbone, the oral surgeon will be able to expose the tooth and then we can bring it down into position. And that's very exciting to be involved in. That will be the progression of the service going forward. So I think we've been able over the last 18 months to start the service up and get it onto a stable footing, and now we can start to expand it to, there's probably 20 to 30 children a year in the Falklands who would benefit from orthodontic care, and I think we're able to provide that going forward, so that's really exciting.